How is the spleen positioned relative to the left colic flexure? Posterior, inferior, superior, or anterior? Superior. The spleen lies superior to the left colic flexure of the large intestine. How is the manubrium of the sternum positioned relative to the body of the sternum? Inferior, superior, anterior, or posterior? Superior. The manubrium is the superior trapezoidal part of the sternum, articulating with the clavicles. How is the xiphoid process positioned relative to the body of the sternum? Anterior, posterior, inferior, or superior? Inferior. The xiphoid process is the small, cartilaginous inferior tip of the sternum. What is the positional relationship between the liver and the spleen? Superficial, medial, ipsilateral, or contralateral? Contralateral. The liver is mostly right-sided, and the spleen is left-sided, making them contralateral. How is the transverse colon positioned relative to the small intestine? Deep, posterior, inferior, or superior? Superior. The transverse colon is superior to the small intestine because it runs across the upper part of the abdomen, above the intestinal loops. Although its position also makes it anterior to much of the small intestine, superior is the main and most consistent anatomical relationship. How is the pelvic cavity positioned relative to the abdominal cavity? Anterior, inferior, posterior, or superior? Inferior. The pelvic cavity is the inferior continuation of the abdominopelvic cavity. How is the prostate gland positioned relative to the urinary bladder in males? Superior, anterior, inferior, or posterior? Inferior. The prostate gland sits immediately inferior to the bladder, surrounding the urethra. How is the rectum positioned relative to the urinary bladder in males? Anterior, superior, lateral, or posterior? Posterior. The rectum is located in the sacral curve, directly behind the bladder in males. How is the uterus positioned relative to the urinary bladder in females? Anterior, posterior, superior, or inferior? Posterior. The uterus is a pelvic organ that normally lies posterior and superior to the bladder. How is the esophagus positioned relative to the vertebral column? Superior, anterior, lateral, or posterior? Anterior. The esophagus descends through the chest anterior to the vertebral bodies. How is the aorta positioned relative to the vertebral column? Inferior, anterior, lateral, or posterior? Anterior. The aorta descends anterior to the spine throughout the thorax and abdomen. How is the common bile duct positioned relative to the first part of the duodenum? Inferior, anterior, superior, or posterior? Posterior. The common bile duct passes posterior to the first part of the duodenum before entering it. How is the fundus of the stomach positioned relative to the body of the stomach? Left, right, inferior, or superior? Superior. The fundus is the dome-shaped superior portion of the stomach, often filled with gas. How is the thoracic duct positioned relative to the esophagus in the lower thorax? Left, posterior, right, or anterior? Left. The thoracic duct ascends on the left side of the esophagus in the posterior mediastinum. How is the aortic arch positioned relative to the trachea at the level of the sternal angle? Right, left, posterior, or anterior? Left. The aortic arch curves over the left main bronchus, passing to the left of the trachea. How are the kidneys positioned relative to the psoas major muscles? Posterior, lateral, medial, or anterior? Anterior. The kidneys lie anterior to the psoas major muscles on the posterior abdominal wall. The duodenum is mostly what to the peritoneum? Posterior, anterior, inferior, or superior? Posterior. The peritoneum is a large serous membrane that lines the inside of the abdomen and pelvis and covers the abdominal organs. It has two layers, the parietal peritoneum, which lines the abdominal wall, and the visceral peritoneum, which covers the organs. How are the jejunum and ileum positioned relative to the peritoneum? Retroperitoneal, intraperitoneal, subperitoneal, or extraperitoneal? Intraperitoneal. The jejunum and ileum are intraperitoneal organs, meaning they lie within the peritoneal cavity and are almost completely covered by visceral peritoneum. How is the sacrum positioned relative to the lumbar vertebrae? Anterior, posterior, superior, or inferior? Inferior. The sacrum lies below the lumbar vertebrae, forming the back of the pelvis. How is the celiac trunk positioned relative to the superior mesenteric artery? Anterior, inferior, superior, or posterior? Superior. The celiac trunk is the first major anterior branch of the abdominal aorta above the superior mesenteric artery. The scapula is located on what aspect of the body relative to the spine? Anterolateral, lateral, posterolateral, or medial? Posterolateral. This is the most precise term, meaning behind and to the side. How is the xiphoid process positioned relative to the manubrium? Inferior, superior, anterior, or posterior? Inferior. The xiphoid process is the most inferior part of the sternum, while the manubrium is the superior portion. How is the sternoclavicular joint positioned relative to the clavicle? Medial, lateral, superior, or inferior? Medial. The sternoclavicular joint is located at the medial end of the clavicle, where it articulates with the manubrium of the sternum. How are the true ribs positioned relative to the false ribs? Superior, inferior, anterior, or posterior? Superior. True ribs are attached directly to the sternum and are superior to false ribs, which attach indirectly or not at all.